Good afternoon, everyone, excuse me. Like B mentioned, my name is Matthew Williams, and I'm the product manager for PKI and one-time password credentials at XOStar. So this presentation is going to be about how we've enabled electronic prescribing of controlled substances using Authy as the second factor credential. But to kind of set the stage for the problem, in the United States, opioids, drug abuse results in more deaths than automobiles or handguns. In 2013, you'll see 46,000 deaths based on drug abuse. Of them, 30,000 were opioid overdoses. So the question is really, how do we get here? Or how did we get here? And in the 90s, the addictive nature of these opioid medications was not well communicated to the providers and also to the patients who were receiving them. This led to widespread diversion of these medications. And so diversion is the term that the DEA uses to describe when someone who's not authorized to receive a controlled substance receives that controlled substance for illicit use. Other contributing factors to the increase in drug deaths are things like doctor shopping or pharmacy shopping. You may be familiar with those. That's where an opioid addiction victim will try and fill multiple prescriptions for a controlled substance at multiple pharmacies to avoid detection. Well, let's go to the next slide in just a moment here. I just locked up. I just totally locked up. Sorry, everyone. My machine's just, I just tried to, there we go. I think my touchpad's not working. I don't know what it did. I have nothing plugged in now. So
No problem.
it's going to hard boot it then. Should have brought it back up left. It wouldn't be the presentation unless something went wrong, right? But yeah, just total kind of lock up there. Moving to the next slide. So we'll bring it back up in just a moment. This machine takes a few minutes to boot up. Do you have another?
Okay. I have my laptop. You want me to grab it?
Sure. Just in case you can pull it down off the drive. Okay. Just a moment and we'll get it back up here. You should use a Mac, right? you add it up too. Okay, this is just yours. Yep. Thanks. Okay, great. Presenter view works well. So, okay, where were we? Basically, I was describing the opioid epidemic, and that it's really become a public health crisis. So, obviously we're here to talk about multi-factor authentication, not about opioid abuse. But like B was saying before I got up here, the authentication is typically thought of in the abstract, and so this is a real problem happening today. Real people are being affected by opioid abuse or drug diversion, and so, electronic prescribing is one of the ways that we can address the opioid epidemic in the United States. So if electronic prescribing can help reduce drug deaths, and Authy helps adoption of electronic prescribing, then by the transitive property, Authy helps prevent death or saves lives. But really, there's two plans of attack when it comes to how the US government and then the industry is attacking the opioid abuse problem. So we have preventing addiction and then preventing abuse and diversion, like I mentioned earlier. So the top three mechanisms that you see on the slide here are the ways that we are addressing the addiction issue. So we're doing things like better educating our patients, expanding medication-assisted treatments like methadone or naloxone. And then when it comes to preventing abuse and diversion, this is where electronic prescribing really can take a part here. One of the main things that electronic prescribing enables, in addition to strong authentication, is the prescription drug monitoring programs, or PDMPs. So here's a quote here from Dr. Peter Kaufman, who's the Chief Medical Officer at Dr. First. And they actually provide a similar service to XOStar. And what he is really saying is the opioid addiction crisis, drug diversion, and overdose deaths are among the primary forces driving the push towards electronic prescribing of controlled substances, to paraphrase. There's other benefits to EPCS, as it's called, or electronic prescribing of controlled substances. Things like the Department of Justice estimates an annualized cost savings of over $700 million across the board. And of course, it makes pharmacies more efficient. It makes medical practices in the ambulatory and clinical space more efficient. And then the main goal that we've realized is that it reduces fraud, abuse, and diversion. Of course, it also enables the PDMPs, or prescription drug monitoring programs. So just a little bit about those real quick. They're state-run databases that collect and distribute data about the prescription patterns of controlled substances within that state. So by routing prescriptions electronically through a network like SureScripts, and we'll talk about that in a moment, we're able to capture all that data and then detect things like diversion or adverse events, where someone may be taking multiple prescriptions that conflict with one another, or perhaps their doctor shopping or pharmacy shopping. So, like I mentioned, SureScripts is by far the primary prescription routing network in the United States. 95% of US pharmacies are connected to SureScripts for electronic prescribing. But you'll see only 88% of those pharmacies are enabled for EPCS, or prescriptions of controlled substances. And even more concerning, only 20% of physicians or providers, healthcare providers, I'll use that term, are enabled for EPCS. And it gets tricky because the DEA gets involved when we talk about prescribing controlled substances. You'll notice if you've ever received a script, you may see the provider's DEA number. Usually that's only required when it's a prescription for a controlled substance. The DEA has mandated that when a provider will electronically prescribe a controlled substance, they have to use what's called a level 3 credential when it comes to defining that level. We're talking about the NIST 863 levels of assurance. Level 3 requires identity proofing or verification and multi-factor authentication. XOStar's Provider Pass platform is our DEA-compliant SaaS solution for EPCS. The capabilities of Provider Pass include multi-factor authentication, identity proofing, and digitally signing the prescriptions as they get routed to the pharmacies for filling. So most electronic health record systems already incorporate some type of electronic prescribing technology today, but they may not, like I showed you earlier, include technology or the capability to electronically prescribe controlled substances or route those through the network. So Provider Pass fills the gap between electronic prescribing and EPCS. We're not routing prescriptions through the SureScripts network to the pharmacies or other prescription networks like that. We are credentialing the physicians or the providers and then digitally signing the prescriptions for the EHR system to then route to the SureScripts network or to the pharmacy. So a little bit about the technology of the Provider Pass platform. Provider Pass is a module that runs on top of a larger multi-factor authentication engine that XOStar has. We call that engine SOTP, shared one-time password. So the SOTP platform exhibits a REST XML API. So all of the SOTP clients, including our own portals and all of the EHR systems, we call them the Provider Pass clients, integrate with that Provider Pass interface and the SOTP API using REST XML over the internet. We issue digital certificates for both ends for a two-way SSL, mutually authenticated SSL connection. When it comes to other services that we leverage for the Provider Pass or the other multi-factor authentication use cases, we leverage external or locally hosted credentialing applications or services, and then identity proofing we'll talk about in a moment. So we really use three technologies for the credentialing side of the SOTP platform. Initially, we supported only hardware tokens from Gemalto. We have other vendors that we've evaluated as well. But we needed to add support for a phone-based authenticator, and this was before app-based multi-factor authentication technology was really big in the market. So we enabled multi-factor authentication via SMS or voice call to the device. So we've been using Twilio to do that for a number of years. We started evaluating app-based authenticators like Authy, actually before Authy was acquired by Twilio, so we've been looking at it for quite some time. To perform the identity verification that's required at level 3, we have a couple different ways that we're able to do that. We integrate with the Experian Credit Bureau in order to ask the provider questions about their credit history. This is a NIST certified identity verification method under the current framework. And of course, about 25% of the providers in the United States are not able to complete that process or opt out of that process or don't know how much their mortgage payment is. And so for them, they can schedule an appointment with our identity verification agent over the webcam. In some circumstances, we can dispatch a notary to their location. All right, so why did we create this multi-factor authentication service or platform? It was really created out of necessity. Like I mentioned earlier, XOStar, or like B mentioned as well, hosts a lot of supply chain applications that manage the supply chain for aerospace and defense companies, and I'll show you a couple of those in a second. We were managing 50,000 hardware tokens directly in the aerospace and defense platform. We were managing 40,000 SMS-based credentials in a different platform. And so out of necessity, we converged all those credentials into what evolved to become the shared one-time password or SOTP platform. So it's been about 5 years since we brought that system online, and it currently manages over 142,000 identities across all of those industries that I mentioned earlier. And EPCS was an afterthought. Once we realized that we had this level 3 certified credentialing and identity proofing engine, we determined that we were also able to meet the DEA's requirement for electronic prescribing for controlled substances. And then we initially partnered with eClinicalWorks, who's one of the leading EHR providers, to build out that API. We've now integrated Provider Pass with over a dozen EHR systems, actually 15 to be exact, and we have 6 more in the UAT environment going through the integration. So kind of a high-level overview of the platform, a little bit more information on the statistics of the platform. Provider Pass, the module we added to SOTP, is only 2.5 years old, but in that amount of time, we've onboarded 14,000 physicians across 15 EHR systems or EMR systems. We're currently digitally signing 600,000 electronic prescriptions for controlled substances every month. And to get to the total here, we've digitally signed 7,139,829 prescriptions for controlled substances, all in just the last 2.5 years, the overwhelming majority of which have occurred in the second half of that, so really just in the last year and a quarter. So how did an identity management company for aerospace and defense, get involved in the EPCS space? Well, life sciences and aerospace and defense are both similarly regulated industries. They are both undergoing a transition from doing research and development in-house and product development in-house to outsourcing that to partners. And they both had a need to be able to collaborate securely, and then those regulatory requirements that flowed down to them to credential their suppliers or partners is where we came into play. So a little bit about XOStar for a moment here. So we were founded as a joint venture between five of the top 5 aerospace and defense companies on that slide. So XOStar is jointly held by all 6 of those companies on the slide you'll see today. In 2000, BAE Systems, Boeing, Lockheed Martin, Raytheon, and Rolls-Royce spun XOStar out to centralize their supply chain management applications. In the mid-2000s, as the industry and the internet began to mature, we saw a need to better manage access into those applications, enabling strong authentication, delegated administration, and other things to make that supplier access to those supplier portals a little bit easier to manage. Then in the late 2000s, 2012 and 2013, we decided to move into one new vertical. We were approached by Merck. They had a similar issue that the aerospace defense companies were having, like I mentioned, about strong authentication requirements for the outsourced partners. And so we were able to spin off our technology and create a life sciences line of business. We currently manage over 500,000 identities across both platforms. XOStar has been recognized as an innovative and business leader. A lot of these are recognition from local programs like the Technology Council of Maryland or NVTC, but we're also proud to be a Gartner Cool Vendor as of last year. So a little bit about the portal here, the genesis of the multi-factor authentication use case. So as a user logs onto the portal, this is essentially a single sign-on portal that provides managed access into a number of applications all around the aerospace and defense or life sciences industry. We connect to over 40 applications across both portals today. Most of those applications require multi-factor authentication, so that's why over 142,000 of the 500,000 users are using multi-factor authentication provided by the SOTP platform. So a little bit of a walkthrough, Authy enabling log on to our life sciences portal. So here, this is our log-on screen. This is where we do our IDP Discovery. So you'll see here that we only ask for the user ID first. That way we can determine if it's a single sign-on user or if we're going to credential and log that user into the portal. So I'm logging on as a portal user. I'm prompted for my password, and I'll enter that. The address for this is secureaccess.exostar.com if you'd like to take a look. Next, risk-based authentication takes place. If I'm logging in from a risky workstation, I'll be prompted to answer some security questions, the password reset questions that we've captured at initial registration time. Or if I've already added that level 3 credential, multi-factor credential to my account, I can log on with that instead. I'm electing to log on with my level 3 credential here to demonstrate what this looks like. This is a wireframe, but you'll see we've enabled both the online and the offline mode of Authy. We have the one-touch authenticator, and we also have the soft OTP or TOTP code. So of course, I'm going to go for one touch. And what we're doing here is the SOTP platform is polling Authy every 2 seconds in the background, waiting for that response from the Authy service. Okay. The Authy service enables a callback feature. We've looked at that, but for the initial rollout, we're just using the polling method. Now I'm logged into the portal. This is my portal dashboard. We have several portals. Like I mentioned, this is our life sciences portal for pharmaceutical research and development use cases. We have the aerospace and defense supply chain portal. We also have airlines logging into a third portal that we've created. What you'll see here is at the top right, the credential strength of the user's current session. So I've logged in with phone OTP. That means that I'm at that level 3 credential level of assurance. Here's an example of a healthcare provider electronically prescribing a controlled substance using an Authy-enabled credential. So we've already credentialed this provider. He or she has added the Authy credential to the account either at initial registration or after the fact. And what you'll see here on the screen is that the provider is prompted for their first factor managed by the EHR system or the electronic health record system. And then they get to decide how they want to use the second factor credential that we've issued. They could elect to use their hardware OTP token, the Authy credential in either online mode, push mode, or TOTP mode. Here's another example from another one of our partners, First Data Bank Meds Tracker. They're more of an e-prescribing plugin for EHR systems to leverage. So they leverage us, and then other EHR systems plug them in for a fully enabled electronic prescribing suite for both non-controlled and now also controlled substances. And their platform, the provider is able to set an affinity for a particular type of credential. So if they've said they want to default to one touch, every time they enter their password and click sign, they'll just get that push notification on their device right away. They love doing that. Some of them use the Apple Watch app for the TOTP credential, and they'll default to that, and they'll just look at their watch and type in the TOTP code. So why did we go with an app-based credential over the perfectly capable hardware OTP tokens and the phone-based OTP credentials via SMS or voice that we already had? Well, we have the top 5 complaints that we get from our providers here on the screen. So the top 2 are really about the identity verification process. We try to make it as painless as possible. Like I mentioned, a lot of the providers, 25% of the providers may say, I don't know the answers to the KBA or knowledge-based authentication questions. We've asked them 4 to 7 questions about their credit history. They simply don't know the answers to those. This is the exact same authentication that you do if you've ever checked your credit report, like at annualcreditreport.com. Or if they've fallen back to the webcam method, they can't start the video conference. We're using an end-to-end encrypted WebEx meeting for this. So we vetted that. It's using compliant algorithms. And so the WebEx meeting sometimes has a hard time getting started on their workstations if they've got some pop-up blockers or antivirus or whatever configuration the enterprise has on that browser. So we also sometimes encourage them to use the smartphone apps. There's an app for Android, iPhone, BlackBerry, and Windows Mobile. But of course, the credential is the pain point. So my hardware token's out of sync. We use those tokens in event-based mode. Those tokens sometimes drift. They forgot their token when they went to work that day, or they think it's cumbersome or annoying to have that token on their keychain and look at the little screen and type in the 6 or 8-digit code each time they log on. So we did a bake-off to decide what type of second factor we were going to add to the system that was more user-friendly. We looked at push-style authenticators like Authy. We looked at touchpad gesture authentication. It was new technology, and we weren't confident in its efficacy at that point in time. Biometrics, of course, require hardware at the workstation, and we're a cloud provider. We don't want to require our users to have any extra hardware at the workstation. Same with proximity and UTF tokens. So Bluetooth proximity is something that's clever. It works pretty well, but the Bluetooth LE or Bluetooth 4 pairing, has to be something that is easily supported by the provider, and we're not workstation or hardware providers. We're a cloud authentication and credentialing provider. And of course, U2F tokens require access to a USB port. So we gravitated towards something that didn't require us to do anything different at the endpoint or the workstation. We looked at Authy, we looked at Duo, we looked at SafeNet. We really chose to go with Authy because they were willing to go through the required audits that we had to pass in order to enable EPCS. Took us 1 week to do a POC. Took us about a quarter to develop it into a fully functional, general GA available platform. It took about 2 months to get through the audits I'll talk about in just a moment. And then we went GA in June of 2016 with the Authy credential. This is high praise from Sanjeev, who's our principal software architect at Exostar. He says the API was very easy to grasp and well documented, especially compared to the competition. We've branded the Authy credential XOStar Mobile ID, powered by Authy. We want that Authy brand recognition because they're using the Authy app on their device. So a little bit about the difference between level 2 and level 3 credentials, like I mentioned earlier. Electronic prescribing of non-controlled substances can be done with just a simple level 2 credential. Basic identity vetting, email address verification, something like that, and a single factor credential like a password. At level 3 for EPCS, we have to do the identity verification using Experian or webcam, and then we have to use a 2-factor hardware-based credential. The registration workflow is pretty straightforward, as you would imagine. You do the identity proofing. You can return after asynchronous proofing with a passcode, or if you're doing the online proofing, you just, in that SSL session, continue with credential registration and binding. It's really up to the EHR system to determine which credentials are required and which are optional. So we see a lot of them requiring hardware or Authy and making SMS optional in any case. And then when prescribing at the bottom here, it's a pretty straightforward workflow. Send the request to us with the hash of the script to sign. We'll send a push notification to the phone if we get it back, and it's successful, we'll sign the script and send it back to the EHR system. I think in the interest of time, I may skip quickly through some of these. This is the identity proofing process. These are some mock-ups and wireframes of these screens. We collect some demographics about the user, and then we'll ask them those 4 to 7 questions about their credit history. Assuming that they answer those correctly and Experian and Exostar are satisfied, we'll credential the user. If not, they'll fall back to the webcam process. We'll allow them to schedule a 30-minute session with our agents. They'll meet with the agent via webcam. There's some resolution requirements that are slightly better than what you're seeing on the screen here, and we'll verify that the document looks correct. As the standard that we're following, NIST 863, evolves, we're going to have a little bit more to do there with verifying the validity of the document. Then, of course, they bind the credential to the account. So here they're going to enter their phone number and email address associated with their Authy ID. If they don't already have an Authy credential, we're going to kickstart that registration process. So they'll get the SMS from Authy to download the app to the device, and then they'll bind that phone number to the Authy service, get the Authy ID, and all the while we're waiting here up to 15 minutes to get that call back from Authy that the credential's ready. Okay, a little bit about the audits. There are 3 audits that we have to pass in order to enable EPCS. The first one is a FICAM Trust Framework audit. So FICAM is the federal government assessment, Federal Identity, Credential, and Access Management framework under the GSA. That determines whether or not we're a level 3 credential service provider, okay, for any use case. Then the EHR system has to go through the SureScripts audit. And finally, we and the EHR together have to go through the DEA audit. The Safe Biopharma audit is the one that goes deepest when it comes to the Authy application and backend service. There's over 70 controls across 6 domains. We're looking at things like the cryptography, whether they're using NIST-compliant algorithms, key management, key generation and exchange, making sure all those things are secure. The registration of workflow of the devices to the account, of course, the authentication workflow at prescribing time, and then the API security between our service and the EHR and our service and the Authy service as well. So we're going to look for mutually authenticated SSL using strong ciphers and approved algorithms. Okay, well, thank you very much. We are proud to have support for Authy in our MFA platform. All of our EHR partners have indicated that the one-touch credential is much more effective and for their providers over the hardware token. So the next time you're getting a prescription, see if your provider uses Authy. Thank you.